Hello, beautiful listeners, and welcome back to Green Earth Essentials. I'm your host, Michelle Jackson, and today we're exploring the fascinating use of essential oils in medical settings. Essential oils have been cherished for centuries for their therapeutic effects, but in recent years, they've moved beyond the home and into hospitals, clinics, and other healthcare settings. In today's episode, we'll look at which oils are most commonly used in medical settings, what research supports their use, and how doctors and other medical professionals are incorporating essential oils into patient care. Plus, we'll dive into how essential oils work to reduce anxiety, improve sleep, and aid in wound healing and infection prevention. And of course, we'll cover how you can use these oils at home to continue your healing journey after a hospital stay. So let's dive in. Essential oils are being used in hospitals and clinics around the world, often for their calming, pain relieving, and antimicrobial properties. Lavender, for example, is widely known for its relaxing effects and is often diffused in patient rooms or applied in diluted forms to reduce anxiety. Peppermint oil is another go-to, often used to alleviate nausea in post-operative patients or those undergoing chemotherapy. Research on essential oils in medical settings has been conducted by institutions like the Mayo Clinic, Vanderbilt University Medical Center, and Johns Hopkins. Studies have shown that essential oils like lavender and chamomile help reduce anxiety, promote relaxation, and even improve sleep quality for patients in both pre-operative and post-operative stages. Peppermint oil has shown effectiveness in reducing nausea, particularly in patients with gastrointestinal disorders or those recovering from anesthesia. In recent years, there's been a growing body of evidence supporting the use of essential oils, which is why some doctors and nurses are more open to recommending them as complementary treatments. For instance, nurses might use essential oils during palliative care or oncology treatments, where relaxation and quality of life are so important. First, let's talk about which essential oils are actually being used in medical settings and for what purpose. Some hospitals and clinics are beginning to integrate essential oils like lavender, peppermint, eucalyptus, and tea tree oil into patient care routines. Lavender is widely known for its calming properties and is often used to reduce anxiety in patients before surgery. In some cases, lavender is also used in post-operative recovery rooms to help ease tension and improve sleep, which can be so important for healing. Peppermint oil, on the other hand, is often used for its effectiveness in reducing nausea. Studies have shown that peppermint can help ease nausea in patients undergoing chemotherapy, those in recovery from surgery, and even in maternity wards for pregnant women experiencing morning sickness. Eucalyptus is another commonly used oil due to its respiratory benefits. It's frequently included in respiratory treatments and used for patients dealing with symptoms of colds, flu, or allergies. And of course, tea tree oil, with its antibacterial properties, is sometimes used to support infection control in wound care settings, although it's generally more common in less invasive treatments. But you might be wondering, what does the science say? Medical research on essential oils is still evolving, yet it has shown some very promising results. Multiple studies have confirmed the efficacy of lavender oil in reducing anxiety and promoting better sleep. One study, published in Evidence-Based Complementary and Alternative Medicine, found that patients exposed to lavender oil experienced significantly lower anxiety levels before surgery compared to those in the control group. Peppermint oil, as I mentioned earlier, has also been extensively studied, particularly for nausea relief. Research published in Complementary Therapies in Clinical Practice found peppermint oil to be effective for post-surgery nausea, offering patients a gentle and natural option. When it comes to infection control, essential oils like tea tree, eucalyptus, and thyme are often used for their antiseptic and antimicrobial properties. These oils contain compounds like terpenes and phenols, which work to disrupt the cell walls of bacteria and fungi, making them effective in reducing microbial contamination. Tea tree oil, for example, is frequently used in hospital-grade hand sanitizers, and it's known to be particularly effective against MRSA, a type of antibiotic-resistant bacteria. The effectiveness of essential oils in antiseptic applications has been widely studied, with findings published in journals like the International Journal of Antimicrobial Agents. While they're not replacements for traditional antibiotics, essential oils can serve as a complementary approach, especially for surface wound care or minor cuts and abrasions. They offer an alternative to synthetic antiseptics and may have fewer side effects like skin irritation or dryness. And recently, More clinical studies are emerging around frankincense and its anti-inflammatory properties, with some researchers exploring its potential for pain relief and even cancer treatment support. Now let's talk about the science behind how essential oils work. When we inhale essential oils, aromatic molecules travel through the olfactory system directly to the brain, specifically the limbic system, which governs our emotions and stress responses. This is why oils like lavender, bergamot, and chamomile are so effective at reducing anxiety. They stimulate the brain to release calming neurotransmitters like serotonin, which help us relax and feel more balanced. For nausea relief, essential oils like peppermint and ginger work by stimulating the brain's centers that control nausea and digestion. These oils contain compounds that may help relax the stomach muscles, which is why they're frequently used for post-surgery or chemotherapy-induced nausea. Essential oils can also have direct physiological effects when applied to the skin. In wound healing, oils like tea tree, lavender, and frankincense have antimicrobial and anti-inflammatory properties. When diluted in a carrier oil, they can help speed up the healing process, reduce swelling, and protect the wound from infection. Research from some dermatology studies indicates that lavender oil can help heal minor burns and abrasions more quickly by stimulating skin cell regeneration. So, are doctors and other healthcare professionals recommending essential oils? The answer is increasingly yes, but with some important caveats. Many medical professionals, especially those in integrative and complementary medicine, are beginning to see essential oils as valuable supportive tools. They are particularly popular among nurse practitioners, physical therapists, and holistic doctors. However, it's essential to remember that medical professionals generally recommend oils in conjunction with and not as a replacement for standard medical treatments. For instance, lavender and peppermint oils are often recommended for stress management and nausea, but with clear guidelines on proper usage and dosage. Safety is key, and trained professionals ensure that patients are not using oils in a way that could lead to side effects or interfere with other medications. Some hospitals have even started offering aromatherapy menus where patients can select from a small range of essential oils tailored to their needs under the guidance of a trained aromatherapist. This trend is making essential oils more accessible and educating patients on safe and effective use in a medical context. What's the future of essential oils in healthcare, you ask? As more studies are conducted, it's likely that essential oils will continue to find a place in clinical settings. But there are a few challenges too. For example, because essential oils are natural products, they can vary in quality, which makes standardization difficult. That's why it's essential to use high-quality oils that have been thoroughly tested for purity and potency. One positive outcome of this growing interest is that organizations like the National Association for Holistic Aromatherapy are working alongside healthcare professionals to create guidelines that promote safe and effective use in hospitals and clinics. This is a significant step forward as it means patients may soon have access to oils that can genuinely support their healing process with a trained medical team guiding them. Now, how can we take what we've learned from medical settings and bring it into our own recovery routines at home? After a hospital stay or any period of illness, essential oils can be a great addition to help you feel grounded and aid in the healing process. For example, you can use lavender or chamomile in a diffuser or a diluted blend for a soothing massage to ease stress and support better sleep. For nausea relief, try adding a drop of peppermint or ginger oil to a cotton ball and inhaling it when you feel queasy. And if you have any minor cuts or skin irritations, tea tree oil diluted in a carrier oil can be applied sparingly to the area to promote healing and keep it clean. When using essential oils for recovery, remember that quality matters. Make sure to choose high-quality, pure oils that are third-party tested for safety and effectiveness. This ensures you're getting the full therapeutic benefits. So, to wrap up, essential oils are becoming a powerful supplement in medical settings. Oils like lavender for calming, peppermint for nausea, eucalyptus for respiratory health, and tea tree for antimicrobial support are just a few examples of how essential oils can enhance patient care. With ongoing research and careful application, essential oils are paving the way for a more holistic approach to healthcare. If you're interested in learning more or incorporating essential oils into your own life, remember to consult with a professional, especially if you have specific health concerns or are taking other medications. Thank you for tuning in to Green Earth Essentials. I hope you enjoyed today's episode and learn something new about the integration of essential oils in the medical field. Don't forget to subscribe and leave a review if you found this episode helpful. And if you want to support the show and gain access to exclusive content, head over to our Patreon page at patreon.com/Green Earth Essentials. Your support keeps us going and allows us to continue bringing you content like this every week. Until next time, stay well and stay inspired. This is Michelle Jackson signing off.